Hi all, I am ARISHA. I have done Bachelor in Optometry from Rehan College of Optometry and Master in Optometry from Malabar College, and I am doing in Fellowship in Strabismus Management from Indian Academy of Optometry. And what is Strabismus? Let's move on to look what is Strabismus. Strabismus is the deviation of eye, which refers to the misalignment of the visual axis, and based on direction of deviation it can be divided into several types. Firstly, isodeviation, that is convergent squint where the eye turns towards our nose, and that of exodeviation, that is eye turns toward outward and it away from the medial plane. And then hyperdeviation, that is the upward deviation. Here one eye will be higher than the other. Hyperdeviation, that is downward deviation. Here one eye will be lower than the other. Cyclodeviation, it's a type of squint where the rotation of eye along the anterior posterior axis. Based on committancy, squint can be divided into committant squint, where the magnitude of deviation is same in all direction of cases and there will be no restriction of movement, and that of incommittant squint, where the magnitude of deviation is different in all direction of cases and there will be a restriction of movement. Based on corneal reflex test, Krimsky-Ishberg test can be performed to quantitatively to detect the angle of squint, and cover test can be performed by cover test, direct cover test, cover uncover test, and then alternate cover test. Direct cover test, it helps to detect the manifest squint, and that of cover uncover test, it helps to perform to detect the latent squint, and that of alternate cover test, it can be performed to detect where the squint is constant or alternate, and it also helps to differentiate between committancy and incommittancy. And let's move on to how we can evaluate a squint in a patient.
And for the evaluation of squint, basically we are using occluder, torch, fixation target for near, and distant vision chart for distance. So let's move on to the evaluation of a squint in a patient in our clinic of 19 years old having a complaint of squinting noted only at the time of illness or tiredness. So first we can move on to the evaluation of committancy. Patient is asked to look onto the target and follow it in all direction of gazes. So first, starting from primary to lever version, that is lever elevation, lever version, and lever depression, and then into center, primary elevation and depression, and then to dextro, that is right side, dextro elevation, dextro version, and dextro depression. And for this patient there is no marked restriction over all gazes. And moving on to Ishberg test, that is corneal reflex test, in which torchlight is shown onto the patient's eye and the position of the corneal reflex is noted. For this patient we can see no displacement in corneal reflex, but on covering one eye fusion is breaking and revealing the latent squint. Then cover test is done for both near and distance, and if the patient is having a correction, asked to view the correction and cover test is performed. For near, asked to fixate on near target. While covering one eye, no marked movement is noted, but on cover and uncovering the eye, we can see there is movement from out to inwards. And alternate cover test is done and fusion is breaking, and we can see the latent squint is revealed. To find the amount of deviation, prism bar cover test is done, and here prisms are placed here based for exodeviation over one eye, and cover test is done, and prisms are increasingly placed until the neutralized is achieved. And if more prisms are placed, we can see the reversal of direction too, and prism less than that will be the right one. Similarly, prism bar cover test, that is PBCT, is done for distance too, and this patient is asked to fixate on the distant vision chart, and prisms are placed and cover test done until the movement is getting arrested. And here along with the horizontal deviation we can see a hyperdeviation too, and hence little baser prisms are placed to arrest the movement. And here we have the result of the patient.